more space here. Is that you?
Yeah.
Does that still work for you? Okay. All right. So, good afternoon and happy Labor Day, everybody. Before I get going, I want to give just a little bit of interesting state history that I don't think anybody knows, because I didn't know until I read this. In August of 1890, Kansas Governor Lyman U. Humphrey issued this proclamation officially recognizing Labor Day as September 1st. He issued the proclamation at the request of the Topeka Trades and Labor Assembly and the Kansas State Federation of Labor. Humphrey expressed an interest in improving the working conditions for laboring people and asked that business be suspended on Labor Day so that working people could enjoy the holiday. The proclamation is considered to be the first official recognition of Labor Day by any head of state, and became an example that other states and the federal government would follow. Just 4 years later, in 1894, President Grover Cleveland signed the first Monday of each September into law as the national holiday of Labor Day. So before I get to the COVID-19 update, it's important that we recognize our frontline workers on this unusual Labor Day. All Kansans who have risked their own health and safety to keep our stores open, to treat the sick, to educate our children, I thank you. On that note, many of our state's hardworking teachers and staff will be back to school with students this week, and many have already returned. Last month, I had conversations with teachers across Kansas and listened as they shared stories about how their school districts were approaching reopening. From the discussions, teachers, I know this year is already proving to be very different and has presented many challenges for you and for your students. Please know that my administration is behind you every step of the way. And I know that regardless of the politics, I will fight to put your health and the health of your students first. Now, on to the COVID numbers. Our state has had 1,694 positive cases and 4 new deaths since last Friday. This brings us to a total of 46,914 infections, 2,441 hospitalizations, and 485 deaths. Yet again, I am very concerned at the way our case numbers continue to grow. Last week, Kansas reported an increase of 23 deaths from Wednesday to Friday, the most massive jump since the Kansas Department of Health and Environment began reporting case numbers every Monday, Wednesday, and Friday. We have seen consistent increases in new cases and stability in test positivity. And that trend will only continue if we as Kansans are not diligent about COVID-19 mitigation practices every single day. Last week, for the first time, I compared our rising number of cases and deaths to the population of several counties and communities in Kansas. I want to do the same thing this week because I believe it is essential for us to acknowledge and recognize precisely how many people this virus is harming. Many Kansans are mourning the loss of loved ones or are now confronted with a lifetime of COVID-19 related health complications. I share these comparisons hoping that they will ground us and remind Kansans that we cannot accept these continued tragedies. Nearly 47,000 Kansans have been infected by the virus. That's the same as if the entire city of Salina had tested positive for COVID-19, or all of Sumner County had tested positive twice over. Over 2,400 Kansans have been hospitalized. That's the same as if every person living in Hoisington were in the hospital, or nearly every resident of Ness County. And sadly, if the 485 coronavirus deaths in our state were concentrated in one area, the entire community of Argonia would be gone. As we come off a holiday weekend, as our children return to school, As sports practices resume and students flood back to college campuses, I fear we will continue to see these large outbreaks. That's why last week I announced that the Kansas Department of Health and Environment would begin releasing the names and locations of active coronavirus clusters. By sharing outbreak locations, Kansans will be better informed about the threat of COVID-19 in their communities and be better prepared to mitigate the virus's spread. This new reporting system will start this Wednesday, September 9th. It'll include the locations of active clusters that have 5 or more confirmed cases. Names of private businesses will be released if there are 20 or more cases associated with a particular location. We must continue to be diligent, wearing masks, social distancing, and washing hands. Finally, before I open it up for questions, I wanted to touch on an announcement that we made on Friday, an exciting new development initiative my administration is working to advance. I've instructed my cabinet to use all resources necessary to push to land the new U.S. Space Command headquarters right here in Kansas. 4 Kansas towns are in the second round of the U.S. Space Command headquarters selection process. Derby, Kansas City, Leavenworth, and Wichita are all submitting proposals. Each of these communities is conveniently located in the national security crossroads, a region with unique national security assets and talent. If chosen, each site would allow the U.S. Space Command to leverage national security infrastructure and skills quickly. Here in Kansas, we have a talented workforce. We have the existing military infrastructure. We have an advanced network of higher education institutions, and we have a world-class public education system perfect for incoming families. Kansas is an excellent fit for this facility, and we're prepared to do the work to get it to come here. I want to thank our federal partners, especially Representative Sharice Davids and Senator Jerry Moran, who have been working very hard on this initiative. I appreciate all of their advocacy efforts on our behalf in Washington, D.C. My administration will continue to do everything we can to assist in this vital effort and make sure the U.S. Space Command headquarters someday calls Kansas home. And with that, I'll take questions.
Have the cases gone up quickly enough now that you're going to have to make some kind of statewide order on the 15th?
You ask me that question every single week. You keep waiting for me to say yes, and I will keep giving you the same answers that, we are monitoring this closely. And we're discussing this with our public health officials, both at state level and the local level, and we are making decisions accordingly.
And on the disaster declaration, which is also the 15th, are you going to seek another renewal or another
extension?
Yeah.
Absolutely, we have to.
And so the folks on the State Finance Council said that their openness to that is going to be kind of contingent on what your rationale is. Are you anticipating that's going to be a tough fight to get them to agree to that, or is that?
Well, ordinarily a governor would declare an emergency when there's an emergency. We still have an emergency here. Just because September 15th comes and it'll go does not mean that the emergency is going to go with it. And so it's absolutely imperative that we extend that declaration.
We're seeing students at the University of Kansas kind of protesting to have online classes only. Do you have a reaction to that or a thought on it?
Actually, I hadn't seen that. So the K-State University students are requesting?
University of Kansas.
Oh, University. Okay, KU students are. It doesn't surprise me. I think that's happening across the country in a number of our higher ed institutions. I think that's just one more thing that the university administration is going to have to grapple with, come to terms and make a decision about whether they're going to go all online or they're going to try to continue to do the hybrid model.
Can I make sure I understand? If you extend the emergency, that merely just means we still have this complicated system set up during which time you can make executive orders. I just couldn't hear you, Mark. The emergency that you say you will continue on the 15th. That just keeps you in the game, essentially.
Well, it keeps our counties and all of our citizens in the game. You know, as I said early on when, you know, we were talking about all of this in June during the special session, you know, if we don't have an emergency declaration, it's impossible for the state to assist our local units of government in dealing with this emergency. So that's why it's not keeping me in the game or not. It's making sure that we can get to the counties what they need to be able to battle this on a local level.
Last question?
We're seeing that officials are being told to start preparing for a vaccine and how they would distribute that. Is that something that's happening here in Kansas?
Yeah. We have pulled together our team at Department of Health and Environment and other entities, and we are working, you know, with the understanding that, you know, at some point in time that there will be a vaccine manufactured and then distributed, come to Kansas, and then we would get it across the state and vaccinate folks against this virus. So yes, we are putting that team in place. It's primarily already in place, but continue to work every day to strengthen it and work with new information that we have so that when the vaccine is created and manufactured and then sent to Kansas, we'll be ready to get it to people.
Are the first responders the keys to that? I don't know how to say this. You can make headlines by giving vaccine to old people who have the disease, or you can give it to people who are first responders who deal with it. Is there a...
Martin, I think that you're asking about who will get the vaccine first. And I think CDC is developing some rather clear guidelines for that. And I think, if I remember correctly, yes, it will be your frontline healthcare workers in particular, and your elderly and other vulnerable populations. And then there's a list of priority from that place forward. I would just hope that they can ramp up manufacture and distribution of this so that we can get the vaccine distributed as widely and deeply as possible.
Do you think Kansans want to take the vaccine? Or has Trump made it more political than a health issue?
I think, you know, I think we have always had folks who are reluctant to vaccinate. We'll continue to have that, but I think by and large, most people, if it is vetted correctly and proven to be efficacious and safe, then I fully expect that Kansans will react to this like they do every other vaccine that they need to take, and they need to have their children take in order to protect them from some disease.
Thank you.
Can that be done by election day?
Which year?
Okay, thank you.
Maybe my reelection, hopefully before.